Ultrasound is very important as we use it all the time in the ED. It's a relatively cheap machine and it is commonly present everywhere. You don't need to be a radiologist to use the ultrasound machine. You can simply do it yourself. And it provides a real-time imaging, meaning that you see the changes as you're probing the patient. If there is any active bleeding, you can see it right away, or if there is some soft tissue injuries, or whatever the issue. If there is an issue and you're probing the patient, you can see it in real time. The machine is non-invasive. You don't need to give the patient any contrast or any injections, and it is also non-ionizing, so there is no risk of radiation. The machine itself is also lightweight, meaning if the patient themselves cannot go to the radiology department, you can bring the ultrasound machine to the patient. The drawbacks is that the machine itself is operator dependent, meaning if the radiologist or the technician or the physician who's using the machine is not skilled, they can have some low quality images. And because it's non-ionizing, it cannot penetrate the skin very deeply. So structures that are very far behind, especially in obese patients, can be difficult to visualize. The field of view itself is also smaller compared to the CT or the MRI, as you see the image as a cone shape. It can also take some time depending on the patient to accurately diagnose the condition, and sometimes you don't have the luxury of time in the ED. One of the most common uses of ultrasound in the ED is in trauma cases. If a patient has some abdominal injuries, especially blunt injuries, with symptoms of shock, you should do FAST, or sometimes called EFAST, which is the focal assessment with sonography for trauma. EFAST is simply extended FAST. FAST is very important because it can detect early signs of abdominal injuries, like air in the abdomen or internal bleeding. We check multiple areas in the abdomen, most notably the Morrison pouch around the liver, the splenic area, the renal areas, and the suprapubic area. With extended FAST, we also check the heart and the pericardium to rule out pericardial effusion. So it is very, very important as an ED physician to be familiar with FAST. You will see it and use it all the time. Another very common use of ultrasound in the ED is to detect acute calcular cholecystitis. A lot of patients have gallstones or gallbladder stones that are present for a long time, but from now and then they can cause some biliary colic or right upper abdominal pain, and every now and then they can also cause acute cholecystitis. This acute inflammation of the gallbladder needs to be treated surgically. And the best way to diagnose acute calcular cholecystitis, which is a very common issue, is using ultrasound. You will see signs of changes in the gallbladder, like thickening gallbladder wall, some pericholecystic fluids, and the gallbladder itself will be distended. These signs cannot be visualized using CT or MRI, but they are best visualized using ultrasound. Sometimes we use ultrasound to detect acute appendicitis in cases where the patient is contraindicated to do CT, especially if the patient was pregnant, or if they have some allergy to contrast or some contraindication to CT. Ultrasound can be used to visualize the acute appendicitis. Ultrasound can also be used to detect pericardial fluid or changes in the heart contraction. We can see the heart contracting in real time, and this can visualize the movement of blood and the opening of the valves. And if there is some fluid around the heart, it can also be detected. And of course, one of the most common uses of ultrasound is during pregnancy, especially early or late pregnancy with some complications. We can see the fetal movement, the fetal heart rate, the placenta, and the uterus. Especially in the ICU, we can use ultrasound to insert central lines, which are catheters inserted directly into the superior or inferior vena cava, mainly the superior vena cava. And this allows you to give large volumes of fluid at the same time, or some very powerful medications like inotropes, noradrenaline, or high-dose potassium. To insert these lines, you need ultrasound. Ultrasound can also be used in the chest to detect pleural effusion, pulmonary edema, or pneumothorax, because you can visualize the lung itself as it expands and as it rubs against the pleura. So the pleura will be fixed, but the lungs will be expanding, and you can see this movement and detect it. For patients who present with swollen, painful, and red joints, we can use ultrasound to detect the presence of collections or fluid underneath the skin or inside the joint itself. Of course, septic arthritis is a very serious condition and need to be treated. But this can be misleading because the joint itself might be fine, but the collection can be underneath the skin. And in that case, the treatment is very different. So we can use ultrasound to differentiate between the location of the collection itself. If an elderly patient, especially smokers, who present with severe abdominal pain and symptoms of shock, they might have abdominal aortic aneurysm, and this can also be detected using ultrasound. In fact, we sometimes use ultrasound to screen these patients for AAA. And finally, if a patient has some swollen calf muscles that are red and tender, they might have DVTs or deep vein thrombosis. And this can be a serious condition and need to be treated early because the complications are very serious. So we use ultrasound to detect the presence of deep vein thrombosis and prevent further complications like pulmonary embolism. This lecture is part of the emergency medicine course. If you find it useful, you can check out the entire course in the link in the description. The course covers everything that has to do with the emergency department, including tests, imaging studies, common cases, and serious conditions. We also have a lot of cases and quizzes that you can take to test your knowledge. Just check the link in the description.